So cute. February is Heart Month. Today is Go Red Day. Of course, we're raising awareness for the American Heart Association.
It is a cause that is really personal for our Fox 4's Shannon Murray, and she joins us now with an update on her daughter Stella's journey and a look at, just how far medical advancements have come, Shannon. It's amazing.
Right, and a lot of our viewers know my 11-month-old daughter, Stella, has a heart defect. It's called tetralogy of Fallot with pulmonary atresia. And so we've been reflecting on her journey over the last year. This morning, I'm joined by the man who performed Stella's open heart surgery, Dr. Ryan Davies, and her cardiologist, Dr. Penn Laird, who will continue seeing Stella for the rest of her life, essentially, and continuing care for her. So first of all, when I say tetralogy of Fallot with pulmonary atresia, people, their heads spin. They're like, what is that? So can you explain just for our viewers, what is that heart defect?
Sure. It's a birth defect of the heart, congenital heart defect that was originally named after Dr. Fallot, who first described it about a century ago. And tetralogy means four things, but there's really two things that are important. The first is obstruction to blood flow leaving the heart, going out to the lungs, and the second is a large hole in the middle of the heart. So the combination of those two results in blue blood bypassing the lungs and just returning to the body, and it results in the typical findings of tetralogy of Fallot, which are cyanosis, a blue discoloration of the skin, and hypoxemia, or low oxygen level in the blood.
Yeah, back in the day, they used to just call them the blue babies, and it was, there was no way to fix it, and these babies would ultimately pass away from this. We now, of course, have so many advancements that's not the case, and that hole in her heart had to be repaired. It required an open heart surgery. Dr. Davies, I started meeting with you when I was pregnant to discuss the plan for her surgery. She ended up having it at 13 days old. She was less than 7 pounds, or her heart the size of her fist. You were able to use a Gore-Tex valve, which was incredible new technology, and I remember you were so excited about this. Explain why you were so excited about it and what you had to do.
So most babies like Stella who need surgery early in life, right after they're born, if we had put in the valves that we usually have used in the past, we know they're going to need another surgery within usually 2 to 3 years at the latest. By putting in this Gore-Tex, expandable Gore-Tex valve, we can hopefully extend that much farther out, because the Gore-Tex can be ballooned open without open heart surgery and make that bigger as she grows, so she's less likely to outgrow that valve early on and hopefully delay surgery much longer.
So our hope is that we'll be able to use a catheter to expand that valve for her next procedure.
That's correct.
Instead of an open heart surgery.
That's correct.
What are you seeing with babies, like Stella, Dr. Laird, as you've been in this profession now for decades? I'm sure like this is one of many advancements that you've seen that's providing better outcomes.
Yeah, when you look at the history of tetralogy of Fallot, my father was a pediatric cardiologist. I had the honor of working with him for many years and garnered a lot of his wisdom. And during the time that he was growing up in the field and training, most patients with Stella's heart condition didn't survive. And those that underwent surgery, half of them didn't even make it out of the surgery. If we fast forward 50, 60 years now, patients like Stella, have a close to 100% chance of surviving to a year of age. They have an outstanding chance of having a normal, healthy life, being able to do all the things that they want to do as they grow up.
Yeah, so it's not only just surviving the surgery, but playing sports as she grows up and being active and living a relatively normal life, which I know you guys both assured us of that that can be possible for her. And Dr. Davies, what about for you, just in your time in this field, seeing all of the advancements that have come?
I think it really has been amazing, like Dr. Laird said. I mean, things like the valve, things like machines that help babies even with sick hearts have a heart pump that can get them to a transplant. Extraordinary technology, but I think the other thing that's really made things extraordinarily better for kids is just the teams that take care of the babies now just know more and work together extraordinarily well to get those kids from what Dr. Laird was saying, where half the kids wouldn't make it out of the hospital, to now basically 100% will who have tetralogy of Fallot.
Thank you both so much for coming in here. Dr. Davies, I haven't seen you since last year, right around the time that we had her surgery. So incredible to reconnect and see you again. And Dr. Laird, I'll see you in a few months. I'm sure we come in every 4 months for checkups. And so I appreciate you both so much taking the time to come in.
Thanks for having us.
And we have much more ahead. Lauren and Brandon on Good Day. In the next hour, we're going to share another story with some other heart moms who are raising a lot of money for the American Heart Association. They are incredible. I can't wait to share that story with you. with you all as well.
Is Stella still here? She was here earlier.
Okay, Stella was here earlier, but she had to go home. You know, it's almost nap time. So
Okay.
It is nap time.
She hit her max.
That
It was time to go.
nap. I remember that night. Okay,
Yeah.
okay. Well, sweet Stella will post on social media because she was here all dressed, red little cowboy boots. I mean, so sweet. But it makes you realize when they say, I mean, just decades ago that she would not have survived. I mean, to hear those words and to know she's here and she's healthy now is just
advancements.
It's a miracle. It's a miracle.
Absolutely
Very cool.
amazing.